Hey friends, good afternoon. And we have been just waiting for this interview for quite some time. And this is going to be an interview with Dr. Prashanth. And this is one of its kind simply because we are just going to discuss about COVID-19. So Dr. Prashanth, amidst of his busy schedule, he has been kind enough to come for this interview. Thank you so much, Dr. Prashanth. And to introduce about Dr. Prashanth, he is the intensivist in NMC Hospital, and he is heading the intensive care unit of NMC Specialty Hospital of Dubai. And he is also heading the infection control department of NMC Hospital. So I don't think I would find any better person to discuss about this. And thank you so much, Dr. Prashanth, for coming for this interview. So if there's anything you would like to add to this introduction, please do.
No, that's all. Thanks a lot, Gerald, for introducing me. And I also was, trying to find out the time, but I think it's very important. Yet the message should reach to the public, the right things which have to be done, and the things which we should be avoiding at this time.
Exactly. The whole purpose of the interview itself is that because now more than the actual message, we do have a lot of myths that's circulating around. And, those are the kind of forwards that we get. And in fact, I had to just turn off the commenting option in my WhatsApp group because of a lot of these unwanted misinformation that's just spreading around. So directly we'll... and also, I do have my co-host, Anita Naidu, with us, a good friend of mine. So she also has got a set of questions to ask. Let us jump into our discussion. So what exactly is this COVID-19, and why is the entire world being so scared of this virus? While we do have plenty of similar, not similar, so many viruses that commonly affect us, and we do suffer from flu. Why is this so different? What exactly is this COVID-19?
Okay, let's go back to sometime back in November, 17th of November, when, now we know that the first patient was suspected of this particular new virus actually went to, China, specifically in city of Yuan. That was the time, this patient was presenting with symptoms which are very similar to commonly known, things which are like flu, fever, cough, and sore throat.
Okay.
And this particular patient had a unique history that he was working in Yuan wet markets, which we normally, say they are actually our business of seafood markets where they sell up these so-called wild animals. So this particular place, this patient had a visit, and probably he was working there. So this particular patient reached to Yuan and one of the public hospital there, and with symptoms of flu, and later it turned out to be a pneumonia patient. So as they move forward, they realized that these subset of patients were coming over a period of time, and somewhere in 31st of December of 2019, when they started suspecting that there is something abnormal with these patients, they are not matching up with their normal profile of flu patients, and some of them also, which were not responding, and even normal flu, which we test for normal viruses, were coming negative. Okay. So they did something test which we known as now PCR test for bat coronavirus. So it's a group of viruses which are found typically in bats, animal, which we know it's a bird basically. So for that particular group of viruses, they tested all these patients, and they found that all of these patients turned out to be positive.
I see.
On further evaluation, they found that this particular coronavirus was not matching. We had some similar type of coronaviruses in our, in our now profile of diseases. They were epidemics before well known, like SARS, which is again an epidemic or an outbreak which happened in China a few years back, 2002. So, but this particular virus was not the same virus. This was closely matching with that virus, but it was again uniquely different. So for this genomic sequence, they found this is a new type of virus. And because it's a new type of virus, so our body has never been exposed. So as humans have not been exposed to this virus, so there is no pre-existing immunity with humans. for this particular virus. That's why there is a response which is very severe because we don't have immunity, and also this particular coronavirus was initially thought to be coming from those particular wild animals who have been exposed to this type of virus. Later on, because of a mutation happened in this virus, so there were few cases of human to human transmission which started happening, and now it has spread from China, from Yuan, then first to the China, then to the rest of the countries, and we already know now this is more of a not a local problem in China. It's already a pandemic which has involved many geographical areas in different places.
Well, yeah, that's a great introduction about the disease. Well, you mentioned that it is from the wild animals, and we do come across a lot of our friends who are non-vegetarians who constantly keep eating non-vegetarian food. So, is there any precaution that one must take when it comes to eating non-vegetarian food, and how is this virus from an animal which is being spread to humans?
Okay, so far what we know at present is this particular virus actually started from bats, but there are some intermediate hosts which we really still don't know. There are few things which have been proposed. There are few wild exotic animals which have been found out, not exotic exactly. They are more of threatened species which are there, which are being consumed by some communities in China. But present, to say whether this is going to affect our normal, poultry animals, which we normally consume as a non-vegetarian food, it's not been proven. And there is no way that you can say that, your normal non-vegetarian food is going to affect you. No, it's been well documented that none of these viruses are affecting your normal poultry like chicken, your mutton, your other meats, sheep, cattle. So they are
not being documented yet. All right.
What is also more important is because there may be carriers, but what is more important, if you eat them in cooked manner, they are quite safe. The one who are handling these animals, they need to be careful as what they are supposed to be careful for all poultry, in poultry farms. They are supposed to be careful with any. As such, there is no documented transmission from a killed one which has been well cooked. All these workers which I tried to do has actually exposure to the market rather than to the one who have been actually cooking this food or have not been entered the market.
All right. Well, so now let's discuss about what precautions one must take as countries are going into lockdown and we hear about quarantine. And as an individual, what are the precautionary measures that we must take? We know that we must wash our hands regularly, and let's go one by one. And tell us about washing hands, and is there any specific thing that one must understand about washing hands?
I just have one question to be added to this part of it. Now, as a family, we have, but for my husband, most of us are like at home. And we've stopped even the maid and other people to come in. But then you cannot stop certain vendors come in, drop things and all that. Now, at such a juncture where you are in the house or isolated from the society, what kind of precautions you need to take staying at home? And what about people who are going out for work and returning home? How do they have to, handle themselves with respect to the family who's sitting at home isolated?
Okay, as Gerald and Anita, you said, these are the commonest things which people are really worried now, because it's no more a China problem. It's a problem which is at our doors. Okay, so to make it simple, we should understand how this virus actually spreads. Okay, so the virus actually spreads from your droplets, which when we cough, the droplets are the one which comes as a small particles in your cough or in your secretions coming from your nose and throat. As most of the commonest presenting symptom for COVID-19 is flu. So flu is normally having a cough and running nose. So the way this virus will spread is basically a droplet, and then second mode of is actually coming in direct contact with all of these secretions and or the patient himself. Okay, so there is something which we have to understand. Droplet typically travels up to a distance of 6 feet.
I
Okay,
see.
so if you are at a distance of around 1 meter, you are at anything above one, you are at a safe distance. So this is important, which we'll be talking a little later also. So anything a distance above 1 meter from a suspected patient, but relatively safe without even PP. Okay, without any personal protective equipments, which we say the simple form as PPE.
Yeah.
Okay. So if you are away from a infected patient at a distance of more than 1 meter, you are relatively safe. Now, other modes of transmission which are well documented are also contact. So where you have not come in contact with the patient, but a patient has touched some surfaces and you are touching the same surfaces, and the same surface will be touched to your hand, and you are taking that hand to your
Nose
face.
and yeah.
So face, which we say is, include your nose and mouth. So the entry of the virus is typically from nose and from the mouth.
So it's
Okay,
not
so
the, when you say face, we are not talking about the skin. We're just talking about the entries,
yes, we
like
are talking about your nose and your
mouth,
mouth and your
ears.
eye. Okay, so these are the areas which are different from an intact skin. So virus is not been documented to covering from your skin of the hand. It
Okay.
has to reach to your face, where the virus will enter, will start replicating, and will start producing a problem. Okay, so if you have touched a surface, so we will go now one by one, and then accordingly we will take a precaution which we have to take. So if I start with the droplet, uh, the droplet is one where we said anything which is a patient is coughing and having a flu. That's why a concept which has been, a term which has now been circulating very commonly, a social distance. Okay, so social distance is a safe distance which you have to maintain from another individual. Okay, social distance is very much important when you are going in community, because you don't know which person is infected, which one is not infected. Okay, it's not something which is there at home possible, but yes, when you are going in a community, when you are going in a public place, there is something known as social distance which you have to maintain. The social distance is given by most of the literature as 2 meter, because as I said, the particle can travel up to 1 meter, so anything above 1 meter is safe. So to be on a safer side, the distance is 2 meter from another individual. Okay, so
Okay.
that what we have to maintain at all our workplaces if you are still going on, or you are going to any other public place. Okay, so
All
that
right.
will save you from any droplets coming from a infected patient.
Okay.
Okay, we have a block. Looks like an internet
All right.
problem.
So
Yeah, so now
okay.
are we still online? Yeah, are you?
Yes. Please go ahead.
Okay. Now coming to the other part, which is a contact one. Okay.
All right.
So contact, basically you are touching some surfaces which have been already either contaminated with the droplets of the cough or by patient himself. Okay. So any surfaces which are in contact by many people are likely to be infected, because you don't know which thing has been touched by the previous individual, whether he was positive or not a
Right.
positive patient. Okay, so in that case, if you are touching any surfaces, it's important to do a hand hygiene, which we say hand washing preferably. If
Right.
hand washing not possible, maybe another type of disinfectant like alcohol or a chlorhexidine. Okay, but
What is the
third and
second one you mentioned?
sorry,
What is the second one you mentioned?
the disinfectant normally we use is alcohol or a chlorhexidine. Chlorhexidine is mostly available in the hospital setups. In most of a community setup, you will get an alcohol sanitizer. Okay, so
Right.
most of our sanitizers are made of alcohol. We will be going this part because Gerald, you wanted to understand that which sanitizers are important and which one are not.
Right.
Okay, so anything sanitizer or a hand wash, preferably a hand wash. If you don't have a hand wash option, do a sanitizer.
So,
Okay, so this
I'm going
way
to interrupt here. So you mean to
Sure.
say any hand wash or any hand sanitizer is okay, or
No.
are we supposed to check something in that?
Okay. Not any hand wash. Hand wash for 20 seconds, but what you are using, whether you are using a soap or antibacterial soap, it doesn't matter. It has to be a simple soap with water. And when you are rubbing the soap, you have to make sure that you are rubbing all the surfaces of the hand, which are very common videos which you can see in Google or YouTube. which are available, different steps which you have to do while washing the hand.
The typical steps,
way is to remember, the most important crucial step is do it for at least 20 seconds.
Right.
Okay. So hand wash with a simple soap and water is very good enough to protect you. Now, if you don't have, or if you are at a place where adequate washing facilities are not there, then you can use sanitizers. So commonly sanitizers which we know are alcohol-based sanitizers, and these alcohol-based sanitizers are alcohol which should be minimum of 60% and preferably of 70%. So if you are buying a sanitizer, the only thing you have to see how much is the content of alcohol. It is written, anything written above 60% weight by volume is good enough to be effective for COVID.
Okay.
There are other type of disinfectants, but that is more for an healthcare. I think most of the community, you will not get these disinfectants.
All right. So again, with hand sanitizer, how many seconds we need to wipe our hands? And again, we need to follow those 6 steps, right?
Exactly. So 6 steps of hand hygiene will be same, whether you do hand washing or hand rub. The rub will be again minimum between 20 to 30 seconds.
20 to 30 seconds. All right. So that's about the hand sanitizer. So we also do see people who just wear gloves and walk around. So
how
do you think that's needed?
This is something, again, a panic, because if you are touching a surface, I understand to make it again very simple for everyone. The virus has been now tested at different surfaces. This information was not available, few weeks back. Now research has come, and people have actually seen how long the virus will be living in different surfaces, and they found the virus will be living in our normal aerosols or droplet for few hours, while the same aerosol, when put it down on a plastic, it will stay for a few days.
All right.
Okay. So just to make it very simple, so virus may be alive on different surfaces between few hours to few days. Okay. So anything which is in contact with another individual has to be taken as potentially infected.
All right.
The gloves give you a protection, which is a barrier protection. Okay?
Right.
Which is a barrier means you are not touching that surface directly. You are not killing the virus. So anything, if there is a breach in that particular glove, still that the virus may enter your hand. What a disinfection or a hand hygiene actually does is it annihilates that particular virus, which is not being done by gloves. Right. So when you wearing a gloves, if you are not doing a hand hygiene, it's a waste. You may actually increase the surface, and you actually transmit from one clean surface to another infected surface, or from infected surface to another clean surface. That's why gloves are not recommended to be used as a routine.
Okay. So, now we know what is the use of a glove and the hand sanitizer, and what about the face mask? And we have heard enough that an infected person is the one who's supposed to wear it. And what is your recommendation?
Okay, my recommendation is basically from World Health Organization. Again, the masks are mainly for healthcare workers. And second one, the patient who is already infected. Okay, so one who is infected with any sort of flu symptoms should be wearing a mask if he can wear.
Any
for
flu
general
symptoms?
Public,
Not
one who is having symptoms, any flu symptoms.
Doctor, normally what happens is people who are carrying the virus hardly know that they are carrying it, and so they are out in the society. And by us wearing a mask, can we protect ourselves from them transmitting it to us?
The answer to this question is a mask which is available in the market, normal face mask or a surgical mask which we use in a medical term, is not protective enough for coronavirus, because they are not tight masks. They are not fully covering your face. So aerosols or droplets can still enter those masks, especially the areas which are not touching the face, and they can infect you. Okay, so if you say that a virus may protect me, a mask can protect me, no. The answer is no. The second question is why should infected patient should wear it? It only helps the society so that the aerosols or droplets coming from a patient will not at least reach to the others. Okay, so
Right.
if you think that mask is helping you, no, the answer is no. The second thing is, now there are other type of medical masks which are available, and we all know there are now people known about a special mask
Mhm.
which is N95 mask.
Yeah.
Okay, again, N95 mask will work for a healthcare worker, are not advised for general public, because we have to do a fit test for these masks. So it's not that anyone can go and start using N95 mask without getting his appropriate size. Then there are enough studies, especially if you have some other lung conditions and you wear these masks, you can start getting breathing problems. That's
Right.
why in UAE the government has banned selling of this mask to the general public. It's only available for healthcare workers, we all know the panic is there. So uh, people start getting these things from different places, but then you are or not getting a benefit, number one. Then, and the other important point is, you are consuming these important personal protective equipments which are really required for some healthcare workers who will be taking care of these patients, and they may get exposed without getting these PPs. So you have to
True.
not think about yourselves, you have to think for the others. This is the time we should be doing that.
Friends, I believe you all heard it right, and it's from an expert. He says there's no need for mask, and it is meant for the patients who are already diagnosed, and it's meant for healthcare providers. And I have to tell you that being a healthcare provider, we are running short of masks, and please do understand this message. And I hope and trust you will all apply it. So thank you so much for that advice, Dr. Prashanth. And the next question is, now, when should someone reach out to the doctor? Like, today morning, a friend of mine called me up and she said, I do have flu, and she wasn't having any other symptoms. And when do you think a person should reach out to their healthcare provider?
Okay, so for this, again, three things have to be remember. One is a patient who has a clear travel history. So right now, our travel means travel to any country practically where there are positive cases. Okay,
Mm-hmm.
and this is available in almost all Google
Yeah.
stores, or most of the, you can search it online, which country has what cases. Okay, so
Right.
any travel history of any of these countries you have, and you are having any sort of flu symptoms, you have to immediately come to the hospital.
Okay.
That is category number one. Then there is another category that one of your friend or relative whom you were in contact in last few days has
Mm-hmm.
been tested positive.
Okay.
Doctor, having said that, um, is there a test that is there which can immediately detect and say, yes, you are infected?
Unfortunately, Anita, we don't have any test which can tell you immediately that you are infected or not. The only test at present available in United Arab Emirates is a PCR test, which has to be done at specific labs allowed by the government of UAE. And these tests normally takes between 2 to 3 days. What is more important is you have to have an isolation. Okay, the testing will only tell you that whether you need further isolation or a quarantine. But if
Uh,
you have any of these flu symptoms, please do not leave your home. Self quarantine yourself at home. Get yourself testing done and wait for the report.
so we
Right.
need
If you are
to
sorry,
we need to see the doctor and then
yeah, what?
quarantine us.
Yes.
We lost it.
All right. So yeah. So we have been discussing about, yeah.
Yeah,
Yeah. Go
category
ahead. Go
number
ahead,
one
doctor.
for travel. Category number two, if any of your contacts were positive. And category number three, if your symptoms are having any sort of
Oh, that's a crucial thing.
better in last. Sorry for that. I'm on phone. Probably the calls are keep on pouring. So any of these things are there. Okay, so any of these three things are there, you have to immediately see a doctor. So most of the
All right.
doctors are doing testing for you now, and they are sending it to us specific lab, and they are also giving you an advice to stay at home if you are not being admitted. If they feel that you are not requiring an admission, they will send you home with a very specific advice that at home you should not leave your home. You should be isolating yourself at home, means you should be taking separate precautions like what we discussed. You should maintain a social distance at home. You should do more frequent hand hygiene at home. You should not share your things with other family members. If possible, use different washroom as compared to other family members, or use your washroom which is at the end of other people in the home. So these
Right.
things have to be followed till your result is negative, or you have been excluded for as a COVID patient, as a suspected COVID patient, as what is
And
recommended by the doctor.
how long does that take to get?
Okay, so if you have a contact history, which we said a travel history or a contact with any infected patients, we take from that day to 14 days, irrespective of the test result. If it's a positive result, automatically you will be admitted and you will be isolated in the hospital. If you are not positive, even then you have to follow the quarantine for 14 days, because it doesn't mean that you are negative, so you will not develop symptoms. Anytime between 14 days from the day of contact, you can develop symptoms.
All right.
And yeah, one last thing. On quarantine at home, can anyone, any of the parent or anybody visit the child who has, let's say, a child from UK has come back home, and
Mhm.
their co-student is affected, and they get to know through any kind of an information from there, and they have quarantined themselves. Isolated themselves. Can the parent visit the child and take care in between? What kind of precautions have to be taken within the house?
Okay, Anita, if I understood it right, just correct me up if I have understood it right. Your question, you want to say that a person who has been quarantined at home was in contact with a positive patient.
No,
Is that correct?
he was in contact earlier, so he has been quarantined. Yeah.
Yeah, because being a contact, he has been quarantined at home. So
Yes.
can other family members take care of the that particular? Yes, other family members can take care of the child. If it's a child, obviously being a parent, you have to make sure that your safety is also being considered. So you don't have to share the things with that particular child. You have to make sure that that particular child stays away from you. It's for your own safety. it and there are simple things which can be done, as I explained a social distance, avoid sharing the bed with that kid, unless if he becomes symptomatic, automatically you have to take him to the hospital. If he is not symptomatic, then even then you avoid till you are quarantined, or that kid is quarantined. You have to avoid sharing the bed, avoid sharing the washroom, avoid sharing the utensils with that kid. His utensils should be washed separately. As I explained, many of almost every disinfectant is good enough. So if you're washing your utensils, that is good enough to take care of the utensils. Okay.
All right.
And not obviously to share towels and other things at home.
All right. So now, having said that, there are some additional things that I follow when I return back home. We just wash our clothes immediately. No, there's no plan of just keeping it aside and then planning to wear it once again or just wash it later. We just have a practice of washing it immediately, and the moment we enter home, we wash our hands properly, and then I go pick my towel, and then I go take a good bath immediately. I also work in the hospital, so I really do not know if I'm just coming in contact with someone. So I take these precautions. So what is your comment on that?
Uh, Gerald, you are doing good. All this should be done as a routine, and these are good hygiene measures, especially if you are working in a high risk area like a hospital. So when you come back, make sure, especially most of the time we have kids at home, so we should change the clothes with the one which you are wearing. For me, it's little different because I always work in my hospital now with scrubs. So it's a different set of clothes. So even the same clothes, because you are coming from an outside area and while you are commuting back to your place, you should change those clothes. They should be rather than putting it behind the doors, preferably
Yeah.
put them into the bin where they can be set off, go for directly cleaning. Most importantly, remember to do a 20-second hand wash.
Yeah.
And third, finally, if you have privilege to take a full bath, go ahead. Otherwise, hand hygiene is more than enough. And obviously, you have taken care of your clothes.
All right. So now coming to the treatment part, we know that we don't have a specific treatment for COVID-19, and yet we do see a lot of patients who have recovered worldwide. And what are these treatments that are being administered, and do we get promising results? So what hope has someone got if they would ever get infected by this virus?
Okay. First of all, we have to understand in 80% of the patients, the symptoms are very mild or they are not present only. So in most of these patients, there is no treatment required.
Wow, that's a good news.
Their own body immunity will take care of the virus. That's what we
Okay.
get for flu. Okay.
We are
So
going to
like
discuss
for
about the
flu, no,
immunity soon. Please go ahead.
yeah. So
Yeah.
it's what your own immunity will take care of the virus. Only in 20% of the patients which require us, which basically have a serious illness and require hospitalization. There have been different type of treatments which have been tried in China and now in Italy. Some of these things have been found useful, especially most of these have been antiviral drugs, the medicines which we were using it so far for HIV patients,
Right.
or some other type of sort of antimicrobials which we were using for malaria, chloroquine, which is
Chloroquine.
so
Yeah.
some of these have been approved by even now US FDA
All
on
right.
a emergency basis. But again, these treatment have to be only taken after consultation of the doctor.
Right.
Okay, because
Yeah.
the evidence which is so far received for these of the trials is not sufficient enough to be given them on a public to everyone.
Right.
Okay, so none of these treatments should be taken without consulting a doctor.
Okay.
First thing. The second thing is most of the patient will not require any treatment.
Wow. So, so you actually mentioned that as our immunity has never been exposed to this new strain of virus, and we may develop these symptoms like flu and cold and cough. So normally at that point, one would reach out to the doctor. So um, do you also think that one may not develop symptoms at all and the immunity could overcome that?
Yeah, this is now well known with COVID that in many patients, they may not even develop symptoms
All
after
right.
being exposed. So they remain asymptomatic. What we say in
Okay.
medical term is asymptomatic. They will never get the symptoms. While there will be few other, rather I should say there are many of them, which gets very mild symptoms, which are matching with just fever, cough, and they start getting better by second week. So both group of these patients, they are still infective.
Okay.
Okay, that's why if you have any flu symptoms, please do not leave your home, do not go anywhere unless only place where you are supposed to go is to the hospital to get yourself tested. Other
Right.
than that place, you should stay home. It is
Okay.
for your own safety and for safety of others.
All right.
Okay, even if the people who are asymptomatic, they can, some of these patients do spread transmission, but most common way of spreading these infection between an asymptomatic and another one is contact.
Right.
Okay, because you don't have cough, so you cannot throw that droplets little far. The only
Yeah.
way you have is if that virus is there on your face, you have touched your face, that will come on your hand and you may touch to another surface,
Okay.
while the other uninfected individual may touch that surface and get it.
Right.
Okay, how the
So
virus
again,
will behave?
What
Sorry.
kind of a precaution does a patient have to take when he or she is entering into society for a checkup, let's say to the hospital if they are visiting? How do they protect themselves from being a contagion? I mean, passing out the infection.
See, if you are symptomatic, as I explained before, you should be wearing a face mask.
Oh,
Okay, if you don't have a face mask, you can use tissues, but tissue, again, a single tissue to be used once. They have to be thrown and you take another tissue every time. So
right.
if you don't have tissues, then at least you can use for your all secretions elbow. Avoid touching your face. Avoid sneezing or coughing in the community.
Right.
Okay, so these things have to be followed. I think this virus has actually taught us basic hygienes, which we should have
Absolutely.
learned it many years back, or maybe we should be,
Absolutely. So
everyone
true.
Yeah.
was teaching us. Probably we never took them seriously. So
So
In
this
true.
fact,
virus is reinstating all that things.
today's news, we
Mhm.
just that the pollution in China has gone way down
Come
in
down.
the past 2 to 3 weeks, and I think it's time for us to realize so many basic things that we have been failing to do so far. Um, Friends, so we are just learning a lot of new things here. Dr. Prashanth is sharing so many things, and we have been breaking some myths, and I'm sure you're being benefited by this. Now, the most important part that we would like to discuss right now is we here and there we just discussed about being immune to the disease, and I want you to share something on that. How could one become immune, or what are your views on that? Though we all have our own views on that, I want you to share your thoughts on that. How one can be immune? What are the things that we have to avoid? What are the things that we have to do apart from everything that we just discussed till now?
Okay, so the first thing is very clear. We don't have any pre-existing immunity. Okay,
Right.
so there is no one who says that I'm immune per se. Okay, so
Yeah.
that is a false myth. Like there was some news that some certain races were immune. No, so it's a pandemic, and everybody, and I think every nationality has already been affected. So all those things were myth. Now coming to the other important part is, can we do something, or can we tell whether I will be immune or not? There is no a magic bullet who can tell you, or a magic test can tell you that your immunity is good enough to fight for this virus.
Right.
It's only when you are exposed, whether you will get infection or not, will only tell how much strong your immunity was. So if you want
Okay,
to
I'm going to
test that
stop you
one.
there. I'm going to stop you there for a second.
Mhm.
So now, when we work in a setup or while we have people around us, and normally
Mhm.
they get flu, they are
Mhm.
infected by one or other thing, and they
Mhm.
just develop
Mhm.
running nose. And
Mhm.
when you don't actually suffer from that, episodes
Mhm.
after episodes for
Mhm.
years,
Mhm. Mhm.
and does
Mhm.
that mean your immunity is good?
Okay,
One
it's a very it's a
that
very
yes. Sorry
it's a very
again.
crude way to measure it like that. Again, it's uh, there are many factors behind this. Okay, so what we understand about immunities, there are multifactorial things. One is whether for that particular for particular disease you have been vaccinated or not. Unfortunately, at present there is no vaccine available for coronavirus.
Yeah.
Okay, so there is no way you can enhance your immunity by using a vaccine, at least for
Mm.
coronavirus.
Right.
Now, whether you did not get a particular infection at that particular time when other person has got it doesn't decide whether you will get a coronavirus or not. Okay, so it doesn't mean that I am healthy, so called I don't normally get seasonal flu, will not get a coronavirus. You may still get it, because it's again decided by many factors. It decides, the first and foremost is how close was the contact with an infected person itself. Second
Right.
thing is how your other things at that particular time. Immunity is not something which is constant, as what we have seen particularly for coronavirus, especially the elderly. The people who are age above 60 are much more at risk of getting a serious illness. It again doesn't tell you that a younger patient will not get it, or a younger individual will not get it. A younger
Yeah.
individual will be as prone to get a coronavirus as an older individual. The difference between older and younger is the older will likely to develop much more complications or much
Right.
more severe illness.
Hmm.
So that probably because of their immunity, which has gone aged over a period of time. So
Right.
as we talked about, there are certain high risk individuals which need to be very careful. A patient who is above 60 year of age, the one who has diabetes,
Yeah.
heart disease, hypertension, and a lung disease. So
Yeah.
these high risk groups have definitely been defined, or any other chronic illness. Okay, so
Okay.
any of these things will decide whether you have a high risk of getting infection or a high risk of getting a complication. But there is no other way to tell, okay, which person will not get an infection. Okay,
Right.
so we should not take it other way around, which one will not get an infection. But yes, there are few individuals which will get a higher risk of infection, which I told you, or may also get higher risk of complications. That's why these particular subgroup of patients should not leave at home at least for next few weeks till the situation gets better.
Right. Okay.
Doctor, these commodities which are being supplied from outside, which we get home delivered, uh, how long are we supposed to quarantine that for some time so that in case there is some infection on that dies down, and then we can, how do we go about with this home supplies?
So I believe you are talking about groceries now.
Yes.
Okay, so groceries at present, government is taking all stringent measures, and I think most of us are getting that messages from different, on the online stores also, that most of these, packings are of these grocery items or any online delivery items are being done in a more on a stringent measure. So it's a message which is circulated everywhere, and I think government is also taking the steps on those angles. Now there are other sort of things which have started now, contactless payments. Okay, so besides payments, even contactless delivery, so you can you may not see the individual directly who has been delivering to or the delivery person who is delivering the things at your home. You can leave a stool or maybe a small chair outside your door. They may put a doorbell and will leave the delivery over there. But again, what is more important is we still don't know whether it is completely safe or not, and that's what public is apprehensive about. The thing is, if you take most of these items, as I said, these things, if you consume raw, are problem. If you are not consuming raw, the things are safe. Okay, and again, most of the problem happens with washing. So if you are washing these things and consuming them, they are relatively safe. If you are cooking most of these vegetables, it's relatively safe. If you are most of the other grocery items, you mostly cook them, and temperature above 60 degree is sufficient enough to kill that virus.
What about the
Okay.
plastic carry bags and the newspapers and those
So they
kind of
have to be thrown. So any exterior packings have to be thrown as early as possible. And again, the things which you have removed, you have to wash your hands. So hand hygiene is again the key concept which has to be done rigorously and repeatedly.
All right.
So all the covers which come in during supply and all that, we need to just dispose them off immediately.
Yeah, dispose them off. That's what we should be doing on a daily basis, because they are more of a shopping bags which have been in touch with many other places, so they should not be used for storage.
Right.
Okay, so
Yeah.
you have to remove those things and put it into refrigerator and dispose them off. While you are using those things now for your daily cook and other things in your kitchen, you have to make sure you are washing them off and you are taking hand wash before and after cooking the food.
Right. So, friends, I hope you got the message right. And if it is carry bags that you're getting, discard it. Do not store it. And that could be the source of your infection. Probably one final question. I do not know if Anita has got any other question. Someone who has got a lung disease, someone who has been suffering from repeated lung disease is more prone for infections. And the other day I was having a discussion with one of my friends who is a smoker. And what is your message for the smokers? Do you think this is the right time for them to quit smoking? I think the audio is interrupted.
It's really harmful, and there should not be, a day we should be waiting that I should be quitting smoking on that particular day or for that particular reason. Yeah, so
at least
everyone
now.
who is smoking should quit in any way. But yes, the important message which is there: a patient or a person or an individual who has pre-existing lung problems,
right,
which smokers are more likely to have, so they will have much more severe illness with corona as compared to any other individual.
Let me say it aloud. Smokers are more likely to get this coronavirus infection. Friends, now take this opportunity. Now there can't be any better time for you to quit smoking. Now is the time. And if there is a certain group of people who could be affected by coronavirus, like you could be thinking, oh, that's going to affect the older individuals and not me, and you may be still a smoker. And then there was in fact one of the myths that was circulating around when I was in fact having this conversation with this friend. He said, where in the world have they mentioned smokers are more prone to be affected by coronavirus? In fact, I came across a post that says the heat from the smoke can kill coronavirus.
So the people who wants to do it, they all find out the reasons to continue to their bad habits or to their habits.
Yeah,
So
one of my favorite doctors, he says people love to hear good news about the bad things they are doing, and they catch hold of it.
Right.
So, friends, so that's about smoking. So you need to quit smoking. So yes, Anita.
One last question. This might be a little iterative, but then I'll just have to go about with this. There's so many surfaces we are touching when they are being delivered home, like I said about the plastic carry bags, the newspapers which come home, which are part and parcel of our life every day to read it, and books and from the libraries. And so, how are we supposed to quarantine ourselves with respect to these surfaces, these materials? Are we supposed to get rid of newspapers, not read them for some time, or?
No, definitely no. I'm doing that daily, so I'm not recommending anyone to stop reading a newspaper. Again, Anita, I think the message which all of us should follow now, and probably again, I said this virus has actually taught us, if it has taught us something, it has taught us to practice good hygiene etiquettes. So if you remember these 4-5 things, there should be no problem, and you can generalize these 4-5 things for everywhere. You should practice hand hygiene before and after cooking food. You should practice hand hygiene as soon as you enter the home, or you are doing any other work at kitchen. You should do a hand hygiene if you have gone to the washroom. Okay, so these are the few things which you have to remember. Okay, now the other important part which I think this particular virus has taught us is avoid touching your face. Okay, so if you avoid touch your face, this will help most of the time, and it's easier to say but difficult to do.
Right.
If you still feel that itch is there, better to touch using your elbow or a shoulder for touching that particular part of the face.
But
Finally,
Dr. Prashanth, sorry again. So if the virus is on us, is it just going to be on our hands, or is it going to be on our dress? Like it may be on my shoulder also.
Again, see, if you're maintaining social distance, so the droplets are unlikely to reach your body unless you are in very close public spaces. Okay, so the more commonest place where it touches is your hands. This is the place which you keep on doing, touching different surfaces, which are invariably you have to do for your mobility, for your daily things, for most of the doors to open, knobs, and they are the high touch surfaces, which are also being used by an infected individual. So if you remember to take care of your hands, that's what I tell to my nursing staff in ICU, because that's the most common infected place, and that's the place where you will definitely get a patient. So remember where you are touching your hands. That if you are very, very particularly looking at that hand, if you can't control anything else, at least try to see where you are touching with your hands. So if you are touching if you remember to see that particular area, you will become very, very careful. So if you keep on looking your hands instead of looking your face, you will remember also not to touch that hand to your face. Okay.
As
so
you mentioned,
instead of touch, if you start thinking like don't have to touch the face, you will start getting a itch.
That's true. Very true.
And the other thing is, if you remember that where I have to take, if I don't have to touch anywhere, something is there in my hand. My hands are most dirtiest thing I have. I don't have to do it. So then you will remember. And if you have to do it, you have to clean them, because they are the dirtiest. So they have to be cleaned very regularly.
Okay.
So that's all.
So otherwise, that I follow is like if it's something that I can't avoid touching my face, then I just take a tissue and probably just do that. Do you think that's okay to do?
That's a good thing to do. But again, if you touch your face by any reason, wash your hands.
Right. Okay. And the other thing that I do is like every time I walk into the washroom or any place, I do carry some tissues with me. along with the sanitizer. So I pick a tissue, or I use that to open the doors or any unknown place. So that's helping me. So
It's actually the elevator buttons and so many places.
These are all which I said before, also barrier hygienes. But again, barrier hygienes are not alone good enough. It has to be supplemented by real hand hygiene or hand wash.
Right.
Okay, so you can use any of these things, but what I will recommend is at the end is something which is well proven and will definitely save you is hand hygiene or a hand wash.
Doctor, one last thing. You said we have to wash our hands after touching the face.
Yes.
After
Why
touching
this is
the face,
important?
after touching anything.
This may, Anita, this may not be important for you, but this may be important for another individual, because even you don't know you are an asymptomatic individual already carrying a virus in your nose.
Oh.
So if you are touching your face, then you should again wash your hands for the community.
Do you have any comment on immune strengthening food and lifestyle habits?
These are the best questions which are left for the last, I think. So I recommend this is the time to avoid fast, avoid dieting, take your balanced diet. I know I have recommended all of you, and most of the places have been closed now. Most of the public parks have been closed. Most of the public spaces have been closed. So do some indoor exercises or maybe a yoga or meditation. So good diet, a balanced diet, and more importantly, if you if you are fond of fruits and vegetables, do continue using them. That is what is actually being recommended for most of the things to to help out your immunity. Also, you should, if you are on certain medication, please continue to maintain that. Diabetes, like I said, diabetes is one of the risk factor. Among the diabetes, if you are having uncontrolled diabetes, you are much more at risk. So if you are a well controlled diabetes, maybe the risk is little less.
All right. Okay, thank you so much, Dr. Prashanth. And I actually promised you that we'll be finishing our interview in 30 minutes, and we are just hitting 1 hour right now. And you were so kind enough to spend your valuable time with us. And I know how busy you are, and I know with things going on around, things are keeping you extremely busy, but we are so thankful to you for just spending your time with us and sharing your knowledge with us, which could definitely benefit many. And I'm sure our friends in the community will be sharing it with their family and friends, so they can understand the truth and not just go about the myths that's circulating around. Thank you so much again.
Thank you so much, Dr. Prashanth. It's been a pleasure to have you on board here.
Thank you, Anita, and thank you, Gerald. Stay home and stay safe. That's all.
Thank you so much.
All right.
Take care.